Okay, it's a wonderful Sunday morning, and we had a lovely worship service. So we're going to try to get some thinking and some conversation started around the topic of compassionate care in crisis. I'd like to just, before I introduce the panel and the topic tonight, I just wanted to say how important this conversation is. I think there's a lot of reflection that goes on around how do we respond to emergencies, whether they be complex or natural disasters, whether they be people in refugee camps or IDPs. And so today this panel today is really going to talk about how faith-based organizations respond to humanitarian emergencies, and specifically how FBO's responses are similar to and different from those of secular organizations. I think we'll specifically talk about how FBOs prepare and respond, how they do their interventions, how they also fundraise around these crises. So I just want to get started. I think we're probably a little bit behind on time, and I want to make sure the panelists have enough time to speak and we have enough time for questions. So our first panelist is Melissa Crutchfield from the United Methodist Committee on Relief, or UMCOR. Melissa, I've actually known for about 8 years, and she's had several different roles with UMCOR in that time, but currently she's the Associate General Secretary for UMCOR, where she oversees international development activities. And prior to that, she was a coordinator for UMCOR's humanitarian response. That included the 210 earthquake in Haiti and Chile, the triple disaster in Japan, the typhoons in the Philippines. And before joining UMCOR, she spent some time at the IRC and worked at the Peace Corps. She has a master's degree in international training and education from American University and a BA in French from Southern Methodist University. So I'm going to actually ask Melissa to come up, and then I'll introduce the other panelists before they speak. Melissa.
Good morning. And I want to start by thanking you all for inviting me to be here, and thanking Rick for asking me to be a part of this panel. It just, in my 6 years at UMCOR, it's one of those things that I'm very conscious of every day about the value of working for a faith-based organization and the way that we do things. So it's really an honor for me to have the opportunity to speak with you all this morning. So I thought very quickly I would just tell you a little bit about UMCOR, who we are and what we do. We are the humanitarian relief and development agency or organization for the United Methodist Church. So on behalf of the denomination, we're the primary point of intervention and activity to implement these relief and development programs around the world. We have 3 core units within our organization. One is that of the disaster response and humanitarian relief, both domestically and internationally. We have the International Development Unit, which focuses on sustainable agriculture and food security, water, sanitation, and hygiene, and economic and social development. And that would include livelihood programs, education programs, and so forth. And then a very, very big priority for our denomination and our organization, and that is that of global health. We do focus on maternal and child health and community-based primary health care and health system strengthening. And I mentioned down here a program called Imagine No Malaria. It's a very large campaign that our denomination is involved with right now to minimize and hopefully eradicate, although we don't like to use that word, malaria. And so that's something that's become a very big priority for us. And one of the reasons that I wanted to present all of this is because today's conversation really is an intersection of how all of those different units work together. So UMCOR has a very, I think, good approach to the way that we respond to the needs around the world. We have direct implementation, meaning we have field offices in 8 countries around the world, and we do that direct implementation, much like other organizations. So that's an intersection of similarity between our NGO unit and the NGOs that may be more secular in nature. We do coordination. That's something that's also very similar, I would hope, across the board. Very important. We coordinate with other local NGOs, international NGOs, governments, ministries within those governments, the UN agency. We're very much connected within that system, and in particular in times of humanitarian crisis and disaster response where things have to be done quickly, this coordination becomes very key. One of the cornerstones, I would say, though, of our approach and the faith-based approach in general is that of partnership and capacity strengthening. And the United Methodist Church and UMCOR, we've embarked on something we were calling the health boards, and it's an initiative that we've created different boards throughout the continent of Africa to manage both programs and the infrastructure that those programs are implemented through. And I'm going to show a quick video, and then, we can talk more. About that. Let's see. This is how I do it. Essentially, the health board model is really the cornerstone to our approach in both health interventions and in responding quickly to other kinds of things that pop up, particularly disasters. And so to put that in context, I gave a few examples here of recent disasters or humanitarian crises that we have or are currently responding to with the help of our health boards. And I focused on a few in Africa. The first being the Eastern Congo conflict and displacement late last year and early this current year. And we worked through our health board coordinator in Eastern Congo to provide medicines and immediate response to a lot of the displaced people who were coming into the Goma, Kivu area. We worked through the infrastructure that was there, and we coordinated with our Ministry of Health and different actors that were on the ground, but it was something that we were able to mobilize pretty quickly because of the connection that we had to the church and the clinics and the folks in that area. Something that we've done more recently, again, coordinated very closely with our health board in the Congo, is to respond to the cholera outbreak. And this is something that we've seen that comes every year. It should be anticipated. It's a crisis, but it's one that we're trying now to work in advance of, to prepare for and respond to, so that hopefully year after year we'll limit and minimize and mitigate the number of cases that are happening and the way that we're able to respond. So we were able to provide essential medicines and rehydration salts. The Congo is an interesting example for the United Methodist Church in particular because we have so many health posts in that country, and so we have quite a network, and that's another thing I think that's a very specific value added and a benefit to the United Methodist Church and the faith-based movement in general, is that we often have these health infrastructures throughout the continent. Some say that between 40 and 60% of all healthcare infrastructure, clinics and hospitals and health posts on the continent of Africa are faith-based, left over from mission initiatives and even new structures that are being built on the continent. So that provides a huge amount of service that's not being taken care of through the government structures. So we were able to benefit a lot of communities by leveraging that connection. Same in Sierra Leone with the current Ebola outbreak. We're working with communities there for preparedness, raising awareness about what Ebola is and how to prevent it. And then South Sudan, the civil conflict. We have a church and a field office there, and we're actually not very active in the zones that are under the current conflict, but we are preparing for the influx of people should they come into the areas where we work. So it's a lot of preparedness and really focusing also on the development needs. And that's one of those things that in times of crisis, sometimes they forget to pay attention to everything else that's going on. So we're also trying to raise awareness about the development needs in South Sudan being a new country so that doesn't get lost just because there's a conflict on the other side. So just to sum up very briefly, I think going very quickly through this rapid overview, and I look forward to answering more questions, but I think that one of the great benefits of the being a faith-based organization is our connectional nature to the churches and the infrastructure that we have on the continent. I think working with these communities of faith that by their very nature have faith and benevolence and want to help and are willing to help and trust. We've had enormous success, especially in some of our prevention of malaria and diseases across the continent, of trusting the pastor. You know, if someone from the United Nations comes in from outside and tries to tell you what to do, you may or may not know who they are or trust what they say. But we've worked with our local pastors and community leaders and volunteers to spread messages that really help aid prevention and preparedness, and also mobilize responses quickly when crises do break out. And so I think that matter of relying on trusted local voices and the fact that we have that connection has really been a huge benefit to our movement and the responses that we've done. So that's my very quick presentation, and thank you very much.
Thanks, Melissa. Our second speaker today is Nicole Hark. Nicole is the Deputy Regional Director for Asia and the Middle East at Lutheran World Relief, where she manages proposal development and supports country office strategies and operations. Ms. Hark has previously worked on election education and civic participation in programs in North Africa and the Middle East. And she has a master's degree in international peace and conflict resolution at American University, and currently began working at LWR as a program associate for Asia and the Middle East. Thanks. Get you up there.
Thank you. It's a pleasure to be able to join you all today. I actually just arrived back from the Philippines last night, so I was wide awake at 3 o'clock this morning and feel like it's already long into the day so far for me. I'm going to speak a little bit specifically about our response to Typhoon Haiyan in the Philippines. But for those of you that may not be familiar with Lutheran World Relief, we are a development agency based in Baltimore, Maryland. We were founded in 1945 by U.S. Lutherans who were responding to the needs of Lutheran communities in post-World War II Europe. Presently, our core program sectors are agriculture, climate change, and emergency operations. So I'm going to focus exclusively on the emergency operations side and not the development programs. But we do have 16 different country offices in Latin America, Africa, and of course in my region, Asia and the Middle East. And we primarily work with local partners as part of a sort of Lutheran accompaniment philosophy of building up the community structures that are there. So for those of you that may be familiar, Typhoon Haiyan struck the eastern Visayas region of the Philippines November 8th of 2013. And there's just some stats here about the impact of the storm. It was significant in the Philippines. They receive a number of typhoons every year. It's actually a very common weather event for them, and something that the government, I think, is relatively prepared for. However, the magnitude of this storm was far beyond what people expected. In fact, one of the things that a lot of the residents we spoke to cited is that they had heard a typhoon was coming. They expected the winds, they expected the rain, but a storm surge as high as 20 feet was not something that they expected. And the sheer size of the storm and how long it persisted was also not something they expected. And there's been comparisons to the Asian tsunami of 2004, both in terms of the type of impact, the number of people displaced in this one region of the Philippines was more than 2 times the number of people displaced in Indonesia in 2004. And the population density of the Philippines is 10 times greater than that of the US. So although it was a relatively small geographic area, we still saw a very large number of people affected, displaced, homes damaged, and of course still people missing to this day. Our current response, we develop our emergency response into 2 phases. So we have our initial relief phase, which is 1 year, and encompasses sort of the first 4 program areas that you'll see on the slide: shelter, cash for work programming, non-food items and material resources, which I'll specifically touch on a little bit more in a moment, quality and accountability in emergency response, which is exclusively focused on helping other agencies to improve their standards, both in lines of the humanitarian accountability partnership standards as well as sphere standards, which are sort of international standards for emergency response, and then WASH, water and sanitation programs. And that began for us in November. We started with our first shelter distribution 2 weeks after the disaster hit, getting kits out to families to repair their homes, and we'll continue until this coming November. And then our early recovery and livelihoods has begun this month in June and will continue until June of 2016. We've committed at least thus far to 2 years of livelihood recovery. At the moment, that's our estimate as to how long it will take before people are fully able to sort of be self-sufficient and back on their feet. But we're not 100% sure. When I was just there, I'm sort of pushing a little bit to see if we can extend for another year, because I think the need is pretty significant at the moment. This is just a map of the affected area and gives you a little bit of an idea of where we're working. Typically, LWR works in rural areas, both for our development work as well as our emergency work, and we tend to pick the areas that are least covered by larger agencies. And it's just a desire to sort of make sure that we're reaching people that may not have been reached by the United Nations or other larger groups, but also in recognition that a lot of our development work will continue in these same areas, and it's more in line with sort of the focus that we take. So we are not in Tacloban, which I think is probably the area that everyone knows about because that's where CNN was, but we're kind of on some of the smaller islands, and our office for this particular response is in Cebu City. We also have an office for our development programs, which is in Davao in Mindanao Island in the south. Our cross-cutting themes are protection, participation, gender, and local capacity, which Melissa already addressed a little bit, and really are throughout all of our programming areas, but I think particularly the local capacity is a part that is core to all of our work. Going to touch a little bit about mobilization of constituents in response to emergencies. This is something Rick and I had discussed a little bit before the panel. So LWR receives a large portion of our funding from U.S. Lutherans, both individual contributions, congregations, and the church bodies. And so when a response occurs, we generally reach out both through social media, direct email, on a number of things to try and raise money to respond to a disaster. And we did a little bit of metric comparisons between the Haiti earthquake of 2010 and the Haiyan response. And it's partially to continue to learn as an organization, but also just to see what trends occurred. So this slide shows total giving from individuals and congregations. And the green line at the top is the Haiti earthquake, blue below is Haiyan. And just to help for those who can't see, because the numbers are a little small, we raised just over $6 million in 6 months for the Haiti earthquake response to LWR, and we raised just under $3 million US dollars in 6 months for Haiyan. And part of that, obviously the magnitude of the Haiti earthquake, 7-point magnitude earthquake, it's very close in terms of proximity to the United States. A number of constituents may have family or friends or have done trips to Haiti, so I'm not making the comparison to say, the Philippines, people didn't care about it enough compared to Haiti, but it was more sort of a way to look at sort of the trends of how giving occurs. We looked primarily at, and I don't think it's a huge surprise, the initial weeks are definitely key for us in terms of raising money. People want information, the most up-to-date information, and for us to be able to share that with our constituents, to go out into the field, to get stories from the people that are affected and to share that with individuals across the US, more so than something that CNN or MSNBC or someone else is covering. This is just individual giving, so removing congregations and church bodies. And again, you'll see that the trend is relatively similar by the first 2 weeks, which are those first 2 points, and then up to month 6, where it sort of plateaus in the 5th or 6th month or so. Part of that is because of the media coverage. If there's no media coverage of a disaster, we tend not to see anybody calling in to ask about it. There are countless other storms and floods and cyclones and earthquakes that we respond to that we never bother to even try and raise an appeal with our constituents, in part because it just won't get attention in the United States. And so that's something that we tend to pay pretty close attention to, is the media actually covering a disaster. And then congregational giving, you'll see, is a little bit different. It's very slow in the first month or so, and then picks up. And I think part of that is pretty logical if you think about how congregations operate in terms of planning out their services, having an appeal when you go to a Sunday service, and then, of course, collecting the money and sending it to LWR. So they may have had an event or something at week 3 or 4 where maybe we're participating with the congregation via Skype, but we won't necessarily see any funds raised for a month after, just because of their own accounting system. I'm going to speak a little bit about material resources and non-food items because that's something that LWR uses as a way to engage our U.S. constituents with our response overseas. Our Quilts and Kits program is what it's called in the U.S., whereas when we speak sort of development speak, non-food items is the category that it falls in. But mission quilts, school kits, personal care kits, baby care kits are all things that are packaged and created by U.S. Lutherans here. And then the shipping fund is money that can be donated to help ship those items overseas. Typically, LWR ships the items to the country, and then our local partner takes care of receiving the materials and distributing them. So we cover the cost of getting it there, and they cover the cost of actually distributing it, normally also working with the government to make sure that it's tax-exempt items when it arrives. We also have a quilt and kit tracker online. So when an individual makes a quilt or a kit and they box it up, they can print a barcode. They put that barcode on the materials that they donate, and it goes into a much bigger box with a barcode. And then that way they can follow their item to see where their quilt ends up. We have a lot of constituents who ask all the time, like, where did my things go? And so we finally decided we needed to create something because we got lucky one time. There was a woman who saw a picture when we were in India at the Mother Teresa home holding a quilt, and she said, "That's my quilt." She saw it on Facebook. And I was like, awesome, like we have a connection. But a lot of times people don't know. They know it goes somewhere. There's a number of countries. So just a few photos. These are boxes in our warehouse. You can see they get the label and the barcode. These are baby care kits. And when they go out, they tend to be stored in either our Maryland warehouse or our Minnesota warehouse. That's the barcode label. This is Carrie. She's in charge of the quilt and kit tracker, so she loves the barcoding system. And then, of course, when they're actually being distributed. So these are some of the personal care kits and the baby care kits that went out. This woman is Melanie, and the baby on the left there was born the day of Typhoon Haiyan. Shella, and so that for her she got a baby care kit, and her family got 2 quilts because she has 6 children now. School kits tend to be distributed through the school system. It's the most logical way for us to do the distribution, and also ensures that it is in part and parcel with the education system. And then in addition to the sort of programs that we work with our U.S. Lutherans, we also do other non-food items that are purchased locally. There's often a big debate, I think, in our community about the value of having us spend $100,000 or more than that to ship something overseas versus using that money to buy something locally. So we do both. We buy things locally, or we provide vouchers so that people can buy what they need. And then we also provide the materials in order to simultaneously engage our U.S. constituents and at the same time address the fact that we want to give people choice. It's also part of why we do Cash for Work, is again trying to stabilize and reinvigorate local markets as well and give people the choice to buy what they need. So that's just a little bit about our response specific to Haiyan, and I'll take any questions later. Thanks.
Thank you, Nicole. Our third panelist today is Bill Sage. Bill is a consultant to faith-based organizations. He has worked both on the governmental and non-governmental side. He's worked with USAID and UNHCR, the IRC, and on the faith-based side, he's worked with Church World Service, International Catholic Migration Commission, International Orthodox Christian Charities. He has a lot of experience and expertise in different emergency settings with a lot of time spent on the refugee side and IDP side. And he also carried out a special trauma program following the September 11 and Hurricane Katrina disasters. Currently, he is a board member of Hunger Relief International. It's a pleasure to introduce Bill Sage.
So, first thing I want to say is there's no PowerPoint here from me, and I'll tell you why there isn't one. I'm a terrible speller, and I have a fear of having the wrong spelling for a word up on a PowerPoint. So I'm just going to share with you some of my thoughts and experiences. I want to touch on three things, if I can get it in 10 minutes, so I may have to ramp up a little bit faster, but there are three things I'd like to just touch on, and then we'll try to intersect them, integrate them, and then there may be more questions afterwards that you want to ask about. The first thing I want to touch upon is the disaster risk and reduction element. We've heard a lot about this. We have a protocol that 168 countries have signed back in 2003. But it's important because nonprofits, NGOs, faith-based organizations integrate this into their programs, both domestically and overseas. It's an integral part because it figures in highly with the element of capacity building of many of the community-based organizations that we work with. So if we look at the importance of it, I would just highlight this very quickly because I think it's important that we recognize that disaster risk and reduction becomes a part of any program that we're working with, and particularly when we're working with partners who are community-based organizations, both domestically and internationally. First of all, I think the most important is that this is a focus that allows for the assessment of potential needs of a community, whether it's a natural or a human-caused disaster. This also gives the community as a stakeholder, a strong say in the management of those resources that have been assessed and are available. It allows for programming. It allows for the reduction, hopefully, and usually, the reduction in the vulnerabilities of loss of life and property. I can give you lots of examples from my own experience. But the one example which always comes to mind for me in terms of having had a protocol and a DRR in place is Boston. In 2003, you might remember the Station nightclub fire. It was one of the most tragic events that we've seen in this country. Over 100 people died inside the nightclub from the fire. Another 230 people were able to escape, and many of them with serious burn victims were taken to various hospitals in the Boston area. The fire actually was in Rhode Island. But because those hospitals had a protocol and had a plan in place to move people in an emergency for medical care and medical assistance, they were able to save a number of lives. And part of the reason that they had the protocol in the first place is because after September 11, most big cities, hospital systems had integrated disaster reduction and mitigation protocols in place to deal with emergencies. So I just touch on that briefly, and then later when we're talking about Syria, maybe I can expand on that a little bit more. The second thing is I want to be very clear about the distinction between IDPs, internally displaced persons, and refugees. 2 days ago was International Refugee Day worldwide. The number of refugees now worldwide is now greater than it's been for almost 2 decades, largely because of the situation in Syria and other locations around the world. But to be clear, when we're using the term refugee, we're talking about people who have left their home of residence, the home where they reside, and flee across borders for reasons of persecution. The other definition, which I want to lift up, but we'll come back to this when we talk about Syria again, is IDPs, internally displaced persons. In this particular context, these are people who are displaced within their own country because of various reasons, whether it's violence, conflict, war, a natural disaster, whatever it is. They have become displaced within their own country. They have not left their country and crossed borders into other countries. So in this particular context, because I'm relating it to Syria, I just want to mention to you that for the number of refugees, the people that have left Syria, there's almost 2.7 million people now who have left, who are now in Turkey, who are now in Jordan, and the largest population, almost 1 million, in Lebanon. So 2.7 million people are what we categorize as refugees, but internally displaced within Syria itself, there are another 9.7 million people. That's almost half of the population of Syria. Now, within that number, it breaks down to those that are in shelters. Some are staying with relatives and friends, and so I won't go into detail about that. But just to be clear about the difference between refugees and internally displaced. So the present time, perhaps with further questions later on, we can come back to this. I would talk about the church response in Syria, which is, in this particular case, the Greek Orthodox Patriarch of Antioch in the Far East, and is also known as GOPA, G-O-P-A. And GOPA has been involved in response particularly since 2002, when the Iraqi refugees flooded into Syria. And at that time, they began their humanitarian response. But there was a lot of capacity building that needed to be carried on, and also to work with them in putting together their own disaster risk and reduction protocol. And over the time from 2002 to the current situation, actually starting 3 years ago when the conflict began in Syria, having that DRR in place has helped them enormously to be able to respond to the current situation. Of course, the magnitude of it is so huge that it takes many actors to be able to respond. But the plan has already been in place, and they have developed it further, and particularly working with various faith-based organizations, community-based organizations within Syria itself, and also with the Syrian Arab Red Crescent Society. So I think I'm near my time, and I would prefer to leave questions, but just to remind ourselves that, the disaster risk and reduction protocol that we build into our programs is important for lots of different reasons. Now, I could give you a whole lecture on that, but I won't right now. And we could talk about refugees and internally displaced. That would probably take me a day. But let me leave it at this point, and if you have further questions, you can come back to me. Thank you.
Okay, well, thanks, Bill, and to everyone on the panel. We're going to start with, I'm going to start with just a couple of questions for the panel. I think they have microphones that they can share, and then we will open the questions up to the audience.
I actually need one.
For the audience. All right. Well, Melissa and I will share this one. All right. So I think, they gave overviews. Every one of the panelists gave overviews on a certain element of a crisis. But I think really the question maybe are in people's minds is if we could look at like specifically, so I'm going to ask this to the whole panel and everybody can hopefully respond. So what is the difference when an LWR or an UMCOR or a Church World Service responds to an emergency versus an IRC? I think I kind of heard a little bit in both in Nicole's comments and Melissa's. But what is the difference? Is there a difference, or does there need to be a difference? So that's kind of three questions. Who wants to start?
Yeah, and thank you. I think I did touch on it a little bit, but I'm happy to dig a little bit deeper. I think we have a lot of benefits and value added of being a faith-based organization. One is the resource mobilization. I find that while we do pursue institutional donor funds and government grants and work with the UN like many other secular organizations, we are very, very fortunate and blessed to have faithful donors. And I think we have a very similar system as the Lutherans. We have the material resources kits that the local churches or youth groups will work together and compile and then send them to our main depots, and we send them out. We have very similar fundraising trends after disasters where the congregations will raise funds and individuals will give. And I think that that's huge, that people more and more want to feel connected to the work that they're giving their donations to. The United Methodist Church is very connectional church by its very nature. We have direct contact with the local pastors and the bishops in countries around the world, and it helps people feel very connected. When they give through UMCOR or through the United Methodist Church to respond to disasters or even development needs, they have this confidence that they're connected to where their money is going, and I think that that is probably true for a lot of our denominations and the organizations we work for. So I think that's a huge benefit that we have. We're able to take a lot of those private funds and meet needs that other people are not meeting. When the CNN effect goes away, we can still be there. It enables us to really accompany these communities for the long term. In cases where institutional donor funds may be looking elsewhere for their own priorities, we can name our own priorities based on the communities articulating those needs to us directly. The second piece is, of course, those communities on the ground. We have that very strong connection with the churches and the communities. It allows us to mobilize whatever activities we need to as quickly as we need to. Through our organization with the health boards, that's a nice, more professional group that we're working with and training to have the skills to be able to implement directly. But we're also able to tap into a huge network of volunteers, community health workers, and I think the benevolence of faith communities really makes them more likely to volunteer. I've noticed in the secular world that there's a bit more reticence to finding volunteers to just volunteer for secular organization. The volunteers themselves don't feel connected. They maybe want to spend their time trying to earn money. Sometimes it's difficult for people to want to spend time for free. But in the faith community, I find that we don't have that problem at all. So I would say those are two key benefits and distinctions of the faith-based communities.
I'll add a little bit to that. Yeah, I certainly agree with those, but one of the other ones I was going to add that I didn't necessarily touch on as much before, I do think there's an element of the local capacity through local church bodies, and also not necessarily entirely Lutheran church bodies, although we do certainly have strong partnerships with those, but all sort of ecumenical organizations within a country, we tend to leverage those networks, I would say, both from a DRR perspective, as Bill mentioned, sort of the advanced training, but also when an emergency hits, the first response is always going to be the local community, particularly if it's a really severe disaster and no one can get there. We knew Haiyan was coming. We had our country director in Cebu 2 days prior to the storm hitting, but she could not get to Tacloban for 3 days because the ferries were canceled because the storm was just that severe. They couldn't actually get people in, and of course the airport was destroyed. So there's that first post-disaster response that has to come from the individuals in the community themselves. And I think that's one thing where we focus a lot on DRR to really try and help the churches understand how they can be effective emergency responders, the role that they can play in helping agencies, both our own as well as others, to understand who are the vulnerable populations in their community, who has been most effective to really affected to help them make those assessments when you first come in and have to kind of make those quick judgment calls, as well as to do some of that early on hazard mapping and helping communities to identify some of their vulnerabilities before a disaster strikes. And I do think that that's something where we have that connection because of the church body affiliation, and it can reach to a different element of the community. Everybody tries to work with the local government. You have to work with the local government and the national government, and that's certainly as well as an important addition to a response, but I do find that we've done a lot with the church networks and being able to utilize church staff and the sort of community within churches to also improve the response that we can provide.
I agree with both of my colleagues. I would like to add two things, however. I think we also need to recognize that within organizations that are not faith-based, that a very high percentage of those who are working do it because of their faith. And so I'm less prone to compare than to recognize that some of the organizations that we all work with, even though they may not be faith-based as such, the people who are actually on the ground responding and working with the organizations, community-based organizations on the ground themselves, take Matthew 25 and Matthew 22 very seriously. So I just make that one first point. The second one is, I think, I agree with all of the elements that have been outlined here, but I would add one more, and that is, faith-based organizations and people of faith tend not to place a timeline on the period of response or the period of time that they're going to help someone. We have within many different areas, Katrina was a primary example. I saw it in New York with Hurricane Sandy, and I've seen it so many times in other places. But, agencies that come into work after a response, and particularly those that are governmentally funded, will be there just for a limited amount of time, and then they're out of there. Faith-based organizations, because they have kind of a continuous pipeline of support for their work, are able to stay longer, make longer commitments, and their goal is to make an exit, but it is not necessarily on a particular time frame. It's based on when they're prepared to go. So the best example for me are many programs where we have churches responding to trauma needs. And through our networks and our denominations, we've been able to mobilize volunteers who are able to go out and work with children, families who are in need of trauma counseling. And those have been mobilized from our denominations and our churches. So they are there for as long as they're needed. Of course, many of them are retired like me. We have plenty of time to do that. So that's another resource, retired people, by the way. So that's what I would add.
Thank you. Okay, why don't we open up, I'm not sure how much time we have left, questions.
Well, I have a question for the audience while I walk up to the person with the question. How many people here have partnered with UMCOR? Anyone? Anyone? Anyone here partnered with Lutheran World Relief? No, just curious.
Hi, Nancy Harris from JSI. I have a quick question and then a harder question. The quick question is, do your organizations implement the minimal initial service package for reproductive health in crises that comes from the UN? But the broader question is, and it builds on William's comment about long-term input, how do you navigate what's called the relief to development continuum? I noticed both of your organizations' development departments are different than relief departments, and those working in the field have found that people that do humanitarian assistance don't necessarily understand development. So it's a big problem helping people move on to sustainable development and recovery even from trauma.
Sure, I'll start. So to your first question, I don't believe so, but that's primarily because I don't know as much about what goes into the kits. I can find out though. And to the second, it is a tougher question, but I completely agree with what you said. I think it is a very tough time to draw a line and say, okay, we're done with relief and now we're, moving into development programming. And part of why I put up the sort of sectors and mentioned the phases that we have is because it's a constantly moving target. Initially, we thought our relief phase was going to be done in March, and we were going to start early recovery in April, and that just we weren't ready. And even now, when I was there last week, part of the conversation was, okay, do we really think in 2 years we're going to be saying everybody's back on their feet and we can move into development programming as usual? And that's a discussion now internally as I come back to our headquarters to say, I'm not confident that we're ready to say that. I think we need more time. And it is a benefit, as we said, that we can go back to our donors, or that we can talk within our agency and say, no, we need more time, and have that flexibility and that sort of understanding. When LWR raised funds for the Asian tsunami in 2004, we raised more money at the time than we had ever raised for any disaster previously, and we committed then and there to a 10-year response. So I am still today monitoring tsunami recovery projects up until December 26th of this year that we are still spending down funding. And part of that is because it is very hard to know at what point you're going to be able to say, okay, now we're ready to do kind of the standard or traditional development work versus the type of impact that this kind of disaster can have. So it is, I think, a hard area to pinpoint that line, and I do think it's something that within our agency, we're relatively small, so we do have an emergency operations unit, but it is the responsibility of my team to be both the development workers and the humanitarian responders. And I think when you have to do both, it forces you to be better at constantly asking that question. When we do sort of needs assessments and have those conversations about where are we now, talking to people, going out into the community and consistently raising that question of what are the needs, to make sure that we're making the decision based on what we're hearing from the community and not what our finance folks are saying or what our own sort of internal timeline dictates it needs to be.
We have a question.
Sure.
I agree. Well, I can't actually respond to the first question. But to the second one, it's a very interesting question because I'm not sure that there is one fixed answer to that. I think it's largely contextual. And from my experience, which is what I would offer you here, that is, we know that in an emergency, to some extent, in the element of trying to respond and meet the needs of people who have very urgent needs, that we respond, and to some extent, some limited dependency is created. But over time, as the situation gets better and the people who are the beneficiaries, the people who are receiving the assistance, are able to care for themselves, or the situation has improved on the ground. So, for example, let me give you this example. In Syria, for example, where water is a problem there are almost 900 different shelters that are housing internally displaced in Syria. And water is a problem, sanitation is a problem. So the first thing before anybody thinks about development is, in this particular context, the war and the violence has to come to an end. So the next step would be, once there is some peace created in which work can be done together. Then I think the next element is to engage the community-based organizations, the contacts, and people that you're working with on the ground in these different locations, whether there's shelters or the water delivery or hospital or whatever, to engage them for their assessment. If things are getting better, then it's time to look at a trajectory that begins to look at development. But I think each situation can be quite different, and obviously in those where there's conflict, war and violence has to come to an end first before you begin to look at things linearly.
Yeah, and thank you for the question. I think it's it'll always be a question because it's a moving target. I think there's never one formula for the relief to development transition. Briefly to respond to your first question, I know that we follow the sphere minimum standards for humanitarian response. I'm not actually sure specifically what we do with the reproductive health kits. I'm looking at my colleague Kathy, who may know, but she's shaking her head, so I won't put her on the spot. But we do strive to meet those minimum standards. So that's something we're very attentive to, and we do try. So with regards to the relief to development transition, our organization actually recently went through a restructuring, and it was out of that restructuring that we created the International Development Unit, separate from the disaster response unit. But as part of that transition, myself and my colleague, I used to be the head of the international development, and now I'm international disaster response, and now I'm international development. And so personally, I actually moved with the transition in our work in Haiti. I was responsible for the immediate response, and then sort of as it was transitioning, it just so happened that I moved into this new role. So that was actually a bit smoother transition because it was just me coordinating with myself. But with regards to the future plans, we do coordinate very closely, and my colleague and I have very direct conversations very often to discern that. And I think that he tries to invite me to be involved as early as possible because, doing some of that immediate response, especially when it begins to transition to the early recovery and the livelihoods component, that's where he's going to step out and focus on the unnamed disasters that are not as publicized. And so he takes that immediate response elsewhere, and we come in at an early state and begin, that long-term accompaniment. I'd also say that that's something, again, that the faith-based community would be well positioned to do because the churches are still there. They're there before the disaster, they're there when the disaster happens, and they're there afterwards. And so that notion of the continuum is really their daily life. And so we just try to equip them and empower them with the resources and the tools and the information to be able to do that well. And specifically with regards to disaster risk reduction, that in and of itself is the development paradigm, right? So you build back better, you try to not put Band-Aids on things and build them back such that the next time a disaster happens, it mitigates the impact of it. And so we do work very closely with our churches, and the fact that they are there really facilitates our transition plan. UMCOR does have field offices, but we work in tandem with our local churches, and the notion of that is that that's our sustainability plan. That is our development plan. And the churches themselves are on the ground. They know what the needs are. They know how to respond. They know what to do. And we just accompany them in doing that. So I think that's really the way we try to be just really sensitive and aware of what they are telling us the needs are and coordinate internally to make that happen.
Okay, I think we probably we're no more time. Okay. Well, I'd like to just quickly say thank you to our panelists. They did a great job. Please give them a round of applause. And thank you very much.